Combating anxiety, the alternative way. Perhaps you break out into a cold sweat when you have to deliver a talk before a group of people. Or perhaps you become nervous when you have to take a test. There are certainly numerous causes for anxiety. Similarly, there are a number of treatment options for those afflicted with the illness. If you don't like the idea of medication, you might try an alternative approach to battling your anxiety. It is estimated that nearly 7% of Americans suffer from anxiety and panic disorders. While prescription drugs are routinely offered as a remedy for such illnesses, they can be dangerous if administered over a long period of time. Some of the more popular anxiety drugs include diazepam and Wellbutrin. According to WebMD.com, diazepam is used to treat anxiety, alcohol withdrawal, and seizures. It is also used to relieve muscle spasms and to provide sedation before medical procedures. This medication works by calming the brain and nerves. Diazepam belongs to a class of drugs known as benzodiazepines. According to drug.com, Wellbutrin is an antidepressant medication used to treat major depressive disorder and seasonal affective disorder. However, increasingly, Americans are turning to alternative medicines in an effort to soothe their anxious feelings. In just the last decade, the demand for alternative medicine has skyrocketed at 300%. This is partially the result of the fact that many alternative medicines offer relief from symptoms, without the side effects linked to prescription drugs. It should be noted, however, that natural remedies are not meant to be long-term treatments, although they can offer relief in the short term. Before you buy a natural remedy, it is important that you do your homework as far as your knowledge of herbs and vitamins is concerned. It is also imperative that you consult your family physician in order to ensure that the alternative treatment is safe for you. A number of herbs offer relief from the symptoms of anxiety. For instance, St. John's wort is one of the most popular anti-anxiety herbs on the market. After taking St. John's wort for as little as 2 weeks, you should notice a difference in your anxiety level. Valerian root is another alternative option you can try. It is especially helpful in combating insomnia because of its sedative quality. In other words, it helps to lull the central nervous system to sleep. Research indicates that valerian root is effective in improving sleep 90% of the time. This is important, since much of anxiety is linked to sleep disorders. Vitamins can also provide an effective treatment for anxiety. They can be quite important in enabling neurotransmitter synthesis and maintenance. For instance, B-complex can help produce neurochemicals, which in turn assists in the synthesis of serotonin, norepinephrine, and dopamine. Yet another aid to combating anxiety is passion flower. It helps to calm the central nervous system, leading to feelings of peace. Meanwhile, ashwagandha root can make you feel stronger so that you are better able to handle the effects of anxiety. But perhaps no herbal remedy is quite as effective as kava kava. This is considered to be one of the strongest anti-anxiety remedies in the world. A number of studies indicates that kava kava is highly effective in relieving the short-term symptoms of anxiety. It is also considered quite safe to ingest, making it one of the most popular herbs available on the market today. An herbal remedy called Pure Calm is being marketed as a safe way to deal with general nervousness and worry. You may feel relaxed after taking only a few drops of this natural substance. However, if you suffer from severe anxiety, including panic attacks, you might consider a remedy called Mind Soothe, which combines St. John's wort with passiflora. Mind Soothe has been linked to good sleep, greater concentration, and better memory. Therefore, it is particularly effective in treating the symptoms of anxiety. We all have feelings of anxiety from time to time. But how can you tell if your anxiety is out of control? If you experience racing thoughts, rapid heartbeat, extreme difficulty resting or you should know in advance, however, that some herbal remedies carry their own risks, and lead to significant side effects. The more you know about herbal remedies, the better consumer you'll be. Don't allow yourself to be a human guinea pig. Take herbal medication only after you have thoroughly studied its effects upon the human body. If you really consider taking a pill, you might ask this question: is taking a pill help combating anxiety? At certain points in your life, you might have been plagued with worry. It might have been in the wake of beginning a marriage, starting a new career, or caring for a sick child. The worry might have affected you not only emotionally but physically as well. You might have experienced feelings of uneasiness, faintness, or breathing troubles. There are degrees of severity when it comes to anxiety. For instance, it can be mild, lasting only a day or two, or severe, lasting an entire month. You might experience generalized anxiety disorder or something more specific such as phobias, panic, or post-traumatic stress disorder. Anxiety might be treated with an antidepressant or an anti-anxiety medication. These antidepressants often have fewer side effects than the older generation of antidepressants. Initially, you might feel nervous taking it, but the feeling often disappears after a few weeks. One of the most important side effects of these drugs is sexual dysfunction, which can often be corrected by changing the dosage. Side effects of anti-anxiety medications include fatigue, confusion, or drowsiness. The medications may be taken 2 or 3 times a day or just when needed. Dosage starts slow then increases until symptoms disappear. The amount of medication prescribed varies according to symptoms, and a person's body chemistry. Doctors generally believe that you should not drink alcohol while taking anti-anxiety medication, because the combination can create a life-threatening situation. Because the medication can lead to dependence, the drugs are usually prescribed for only days or weeks at a time. In fact, a user might be directed to take the medication only when symptoms of anxiety occur. In some cases, individuals suffering from anxiety may need treatment for an extended period of time. If you begin taking anti-anxiety medication, it is important that you stay on it until the doctor recommends that you stop taking it. If you stop abruptly, you may experience anxiety, dizziness, or loss of appetite. Common forms of anxiety medication include Valium, Ativan, and Xanax. At times, physicians may prescribe beta blockers to combat anxiety. While beta blockers such as propranolol may be used to deal with heart damage, they have also emerged as an effective treatment for social anxiety. If you face a stressful situation, such as a job interview, your physician may give you a beta blocker that can keep your palms from sweating, your head from swelling, and treat other symptoms of anxiety. There are certain steps you should take before you begin a drug regimen for anxiety. For instance, you should do your homework on the drug. Find out what side effects it causes, and determine whether you can live with those side effects. Also, you'll need to inform your doctor of any over-the-counter medications you are using. Be sure to find out how long you will have to take the drug. You should realize that if you decide to stop taking the drug, you could find symptoms of anxiety reappearing. If you've been diagnosed with anxiety, it can be a daunting experience. You may not know where to go or who to turn to. However, it's best if you begin your search for treatment with your family physician, who can refer you to a psychiatrist if needed. By working closely with your physician, you can find the medication that's appropriate for you. However, you should know that medication may be only one part of the treatment puzzle. You may also need to engage in talk therapy, or join a support group in order to alleviate your symptoms.